Hi, I'm Dr. Michael Spira. Today I'd like to have a look at one of the most common conditions that causes pain in this country, and that is arthritis. It is the leading cause of disability in people over the age of 50 and causes a lot more misery than almost any other condition that you can think of. Now, as you know, the internet is full of remedies for arthritis, ranging from Chinese herbals to quack remedies, most of which have got little or no research to back them up. So I've had a look at a number of products which I think strike me as being potentially extremely helpful for this condition. Now, I'm going to have a look at ones that you probably know quite well, I've heard of, glucosamine and chondroitin, but I want to start off with one that may not be quite so familiar, and that's organic silicon. Now, you're probably familiar with silicon from electronics, etc., but that's not its only use. Silicon, in fact, is one of the commonest elements. In fact, it's the second most common element after oxygen, and it does form about a quarter of the Earth's crust. It's very important for us because a deficiency in silicon can actually cause bone defects. So that's why it's particularly important in arthritis as well. As you know, I'm particularly interested in knowing what the research shows, what the scientific evidence for any supplement is. So I've had a look at quite a few of the papers that have been published over the last few years, and I'm going to share some of these with you. Let's look at the first one. This is a paper which was published in 1997 at the University of Antwerp in Belgium. And they reported a study in which supplementary intake of a small amount of silicon resulted in an increase in the blood levels of silicon of 70%. But what was even more interesting was that the concentration of silicon in collagen increased by 12%. Now, to understand the significance of that, obviously we need to know what is collagen and why is the increase in its silicon content important. Collagen is a type of protein. It's got a very long fibrous structure, and it's important because it's very strong and it connects and supports other body tissues such as skin. And probably many of you will be familiar with collagen being used these days in dermal fillers and so forth. But it's very important in arthritis, for muscles, for bones, for tendons, and for cartilage. Now, another piece of research which particularly struck me because it came from the Raine Institute at St Thomas's Hospital in London, which is, of course, a very eminent institution. They studied 2,800 plus patients. They actually found in that particular study that the higher dietary silicon intake in men, and particularly in younger women, may have very significant effects on skeletal health. Another study published in 2006 in partnership with the International Osteoporosis Foundation. As you probably know, osteoporosis is a very important condition which is thinning of the bones, which occurs in older people generally speaking. And they found that the bone mineral density was increased by giving supplements of silicon, and could actually help to prevent loss of bone structure. A few years ago, the Bone Journal concluded that organic silicon can stimulate the production of collagen. So, to sum up about silicon, there are several studies which have shown that silicon, organic silicon, is essential in the formation and the repair of bones and joints. Now, I want to turn to a couple more products, in fact 3 more, which I've already mentioned. One is glucosamine, which I know most people are familiar with. It's been around for over 20 years. It's pretty well a household word these days. And of course, a lot of us are taking glucosamine as a regular supplement anyway. Is there actually any evidence for it that it works? Well, there is, of course, a lot of evidence. I'm not going to go through it all, but just to mention, I've got here in front of me a paper published in The Lancet in 2001, another paper published in the Archives of Internal Medicine, another one in Drugs and Aging, all showing the importance of glucosamine in helping our bones and joints in particular. Moving on then to chondroitin. Again, many of us will be familiar with chondroitin because it's often combined with glucosamine. And that again is an important structural component of cartilage. Cartilage being the lining of bones in the joints, so that bones can slide across each other without causing any pain. Another very interesting paper, which was published a few years ago, showed that the walking time, that's a very interesting concept, a very good way of measuring the effects of a supplement on joints. The walking time is defined as the minimum time to perform a 20-meter walk. And the paper here that I have in front of me showed that the use of chondroitin significantly reduced walking time, and incidentally also reduced the amount of painkillers that people had to take. So to sum up about chondroitin, there was a paper published by the University Hospital in Zurich, and they said that we definitely have enough clinical data available supporting the view that oral chondroitin is a valuable and safe symptomatic treatment for osteoarthritis. I'm going to move on now to another product which many of you may not be quite so familiar with, and that's blackcurrant. Blackcurrant seed oil, blackcurrant juice extract is very rich in essential fatty acids, and it has the action of suppressing inflammation, which of course is what happens in arthritis, and it reduces the signs and symptoms of disease activity in patients with one of the most serious forms of arthritis, which is rheumatoid arthritis. And incidentally, blackcurrant also is very rich in antioxidants. I'll just talk about one piece of research. There was a randomized, double-blind, placebo-controlled clinical trial published in the British Journal of Rheumatology, which is one of the most preeminent journals in the country, in the world in fact. They published a trial in which they showed that treatment with blackcurrant resulted in reduction in the signs and symptoms of disease activity in patients with rheumatoid arthritis. In contrast, those patients who took the placebo, in other words, the dummy, showed no change in the disease. So their conclusion, and this is the British Journal of Rheumatology, was that the study indicates that blackcurrant is a potentially effective treatment for active rheumatoid arthritis. So there we are. We have organic silica, we have glucosamine, we have chondroitin, and we have blackcurrant, all showing through very good quality research that they can have very important benefits for us in terms of our bones and our joints. So I hope you find that helpful and interesting. If you want more information, please do click on the website, and I will simply say thank you very much for listening.